Hi, my name is Dr. Roebling. I am a PGY2 at the Choctaw Nation Family Medicine Residency, and I did a project on increasing physical activity in the older population alongside Dr. Dole and Dr. Quinton too. So it's estimated that adults 65 and older comprise about a fifth of the population as of 2024, and this percentage is rapidly growing over the past 15 years, and they often have chronic medical conditions, low fitness levels, and then other limitations that could lead to decreased activity and increased costs. And they're often seated for over 50% of their waking time. And often, this less activity can lead to worsening health outcomes, whether that be cardiovascular disease, obesity, or depression. Currently, the American College of Cardiology and the American Heart Association recommend this population to get certain amounts of aerobic exercise, flexibility exercise, as well as resistance training. Since this population is rapidly growing and would highly benefit from routine exercise, it's imperative that we increase their baseline exercise rates. So, the aim of this study is to increase total minutes of physical activity per week in those 65 years and older by at least 25% over 3 months. We used an IPAC questionnaire to screen patients 65 and older for the amount of exercise in minutes that they performed weekly. They were then provided handouts of exercise regimens for stretching, aerobic activity, and strength training with the modification available. After 3 months, they were reassessed to see what the change in exercise minutes was. So we started with 13 patients, and of those, two were lost to follow up. So we did not include their information in the baseline data here. So only 11 patients were included. Our patient population initially averaged about 372 weekly exercise minutes, and then after getting those handouts, 3 months later, they averaged about 282 minutes. We also collected information on their weight, and they did drop 1 kilogram over the course of the study. However, we did not control for other factors that may influence this, including food or medication changes. Of the 11 patients that we included, three initially reported zero exercise minutes at baseline, and all three of those did have an increase in exercise minutes from zero. And then we also asked who would be likely to continue exercising, and 82% or 9 out of the 11 did intend to continue exercising. And the two that did not, one of them did not start exercising, and then the other one had severe chronic pain with limitations. But overall, 82% did state they would continue. So, unfortunately, our aim of a 25% increase did not happen. There are a couple limitations to this study that may suggest why. For one thing, our sample size was very small. We only had 11 patients, and this is kind of due to constraints of continuity clinic in a residency program, but a larger sample size may give more accuracy. Also, we believe many of the patients did initially overestimate their baseline exercise minutes as they had not previously been tracking it. In conclusion, physical activity is definitely imperative for overall health and independence. And although we did not meet the aim of this study, we believe there is some benefit given that three of the patients did have an increase from baseline, and 82% of them did intend to continue exercising in the future. For a future QI project, this could be tested on a larger population as well as a broader age range, although we do recommend having a better method of getting the baseline exercise minutes, given the likely overestimation we saw. So, if you have any questions at all, please do not hesitate to contact me. And thank you so much for listening.